Hello, this is Dr. Gay from First Look MRI, and this is a 16-year-old male with a recent injury, and this is just a quick test for radiologists. On this one view, we should know what is going on, so I'll give you a few seconds to decide. And there it is. So this is a sagittal view where we can see the femur. We have a bone bruise here, the lateral femur. We know it's lateral because the fibula is here. This is the tibia, and we see another bone bruise here. So these are what we call kissing contusions. This bone moved forward and hit right here and then went back to normal position. And this is associated with a pivot shift type injury. And when we see these bone bruises like this, we know that the ACL had to be stretched. For this to move way over here and hit and come back, we had to at least stretch or tear the ACL. So now we're going to look at the ACL and see what it looks like. The ACL should go through here. We don't see anything that looks normal there. But on this view, we do see a little structure that comes down and horizontal. Right here it's more horizontal than vertical. Normally the ACL is very straight, and we should see it on this view, but instead it's lax, and here's part of it. So it's a high-grade partial tear. It's stretched and attenuated. This could be completely torn. Sometimes it can be faked out, and the two torn ends will just blend together. But there's no shift. This tibia is not moved forward. We can see the back of the femur and the back of the tibia relatively at the same spot. Usually when the ACL is ruptured, the tibia will move forward or drift forward because the ACL is not doing its job. But in this case, it's not shifted, so maybe there are some intact ACL fibers right here. And that's it. So typical bone contusions, when we see these here and here, we know that there must be an ACL injury.